Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Barnacle, the LabZtorm, the LabZtorm and Baracade. This audio podcast is part of the Barnacle and Storm and Bostics. This audio podcast Synopsis as part of the Ship Mode Squad, and this audio podcast Synopsis as part of a Storm Labostics production. So, in on this audio podcast and the synopsis, a little bit around this audio podcast series or chapter or sorry or episode. So this works. There was a collaboration that took and that had taken place in more recent times. Wherein there was a collaboration between an organization referred to as Hip Hop Gardens, a Hip Hop Gardens based in a Hip Hop Gardens team in the United Kingdom, and in line to a collaboration with through an academic institution, an academic institution in the southwest, and also in around where the collaborations were aligned to two social media platforms: the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS Group for Kids, social media platforms, and also in around an academic institution overseas, where collaboration was with an academic overseas where a colleague was where one of the collaborators was from Singapore, in around Singapore. The project in around this works and the project or this the sort of works that have been co-developed. It was primarily looking at understanding polypharmacy and bridging best practices through hip hop and permaculture, and the collaboration was between an organization primarily referred to as the Bristol Drugs Project, BDP, and the Hip Hop Gardens and Hip Hop Gardens and the Hip Hop Gardens team in the United Kingdom. So a little bit around this, in as part of a synopsis. So the National Health Service (NHS) is driven by quality and patient outcomes, and the increase in provision of point of care testing healthcare services can assist in supporting best practices, as highlighted in what's referred to as National Health Service or NHS outcomes framework. So, during around 2023 and 2024, a collaborative effort took place across organizations to better understand challenges surrounding polypharmacy, in addition to learning about permaculture through hip hop. The collaborative effort looked to present several international workshops to unite communities with a focus on young people. At the same time, the collaboration prompted the co-development of several workshops between August 2023, April 2024, May 2024, May 2024, and also September 24. The focus was on polypharmacy and understanding nephrotoxicity, healthcare service users having ability to make healthcare decisions, envisaging brighter perspectives, and attaining well-being through permaculture and expression. The workshops attendance ranged from approximately in around 30 young people to about 150 people across the different workshops, and over the workshops there was a conversion rate of approximately 15 routine attendees, and in a single week there was an average of 11 to 12 who attended each workshop, and a low of 10. Overall, the collaborative project was a huge success. United communities, a huge success which united communities to collaboratively prompt awareness surrounding permaculture, co-developing opportunities to expand efforts in communities, and each workshop featured sort of the main facilitators of the Hip Hop Gardens team. Polypharmacy has become an increased societal norm, across populations, and not all polypharmacy and or nephrotoxicity, for example, can be entirely precluded. It is to be noted that populations should have an awareness concerning polypharmacy, and especially if it leads to nephrotoxicity. However, awareness that specifically targets and elicits targets or elicits that specifically targets illicit substances is lacking and should be addressed in prospective works. Ultimately, all inappropriate polypharmacy can induce nephrotoxicity, and it is difficult to determine or distinguish, and it is still a focus in the remit of toxicology and drug compounds. Having access to different allied health professionals should also encourage healthcare service users in around aspects of healthcare to feel more included, thus increasing the practical understanding surrounding best practices, including in around permaculture. Works that can be utilized, terminologies that can be utilized in search engines to identify similar works. Terminologies include polypharmacy, permaculture, nephrotoxicity, and hip hop, and where the terminologies can be used in different ways to identify similar literature. On this audio podcast, and as part of the audio podcast series, there will be some citations and references that are part of the as part of the audio podcast series, a series or episode. Thank you for tuning in.